diseases. Can you talk us through what the risk factors are and what, you typically tell a mother
When
or the
we,
family?
yeah, one is a known diabetic coming into the clinic, or we pick up the gestational diabetes and talking to her because she herself, she has to be watchful about her BMI and weight gain during the pregnancy. The
Hmm.
risk of development of hypertension and preterm birth is more,
Right.
and the baby being macrosomic, and then prolonged labor, difficult birth, and the baby later life developing obesity. So we'll talk to her about the maternal factors and the
Hmm.
fetal factors and the outcome at the time of birth, and then the follow up of the baby. So first time it is very difficult to talk everything. Suppose
Hmm.
a lean mother comes and we started doing screening HbA1c once we standardize the technique. And if high risk, we screen at 16 weeks and then at 24 to 28 weeks. And 24 to 28 weeks, first time when we say that, your sugars are a little higher. So we bring in slowly the medical nutrition therapy. And we
Hmm.
tell them like, if you're good and you eat healthy food, 80% of you may not require any medication. Let's work slowly. Your sugars are a little higher than normal. But we
Hmm.
have to be communicating with them every 2 weeks over the phone or a teleconsult instead of bringing them to the hospital. At the
Right.
same time, monitoring the fetal growth is important.
Hmm.
So that's how we bring them to understand the problem. And first thing they say is, no, there is no diabetes in the family. My
Hmm.
mother never had, none, my sister never had, and your sister, I mean, your test may be wrong, and they'd redo it somewhere else.
Hmm.
So we tell them slowly, no, these changes can happen during pregnancy. So
Hmm.
let's wait and watch. I'm not labeling you, but because these days they become very they're misunderstand the information. The Google gives them a lot of some information, colleagues give them some information. So
Hmm.
explain to them about the risk, because they stand higher risk of hypertension and premature births. And similarly, they have excess of urinary infections. Some mothers develop urinary tract
UTI.
infections and
Hmm.
repeated infections, not amenable sometimes to antibiotics. So, and also their basic BMI, how, because now we look at 30% has become normal BMI. It was
Hmm.
not like this 20 years ago. Dr. Usha may be knowing. So
Correct.
30%, 30 BMI is normal. Like 30%
Hmm.
of the mothers coming to clinic, they start with a BMI of 30.
Wow. Yeah.